Welcome to This Explainer. Today, we are taking a completely fascinating, incredibly deep dive into the intense but absolutely life-changing world of a clinical NAD plus IV treatment. If you've ever heard the term cellular biohacking, or if you've just kind of wondered what it actually means to reset your body's energy at a literal microscopic level, well, you're in the exact right place. We're going to walk through the complete step-by-step clinical procedure, decoding every single sensation, all the side effects, and of course, that ultimate euphoric payoff, based directly on a recorded clinical session. So let's jump right in and break down exactly what happens during this cellular biohack. Okay, let's dive into the deep end right away. I want you to listen to this actual real-time patient reaction just mere minutes into receiving an NAD plus strip. He says, "My whole cavity is going to pop. I'm sweating. It feels like I drank 20 cups of coffee." Wow. I mean, it sounds absolutely terrifying, doesn't it? It totally begs the question, what kind of wellness procedure causes a patient to visibly glisten with sweat and feel like their chest is expanding? To understand why this happens and why people literally line up to do it, we really need to demystify the whole process. So, here is our clinical roadmap for today. 1. Preparation vitamins. 2. NAD plus drip process. 3. Handling side effects. 4. The different feeling. And 5. Doctor's advice.
Starting with Section 1, Preparation, Vitamins, the essential primer.
Right off the bat, we begin our clinical walkthrough in the chair by preparing the body's veins. You don't just walk in and immediately hook up to NAD. The procedure is actually a strict three-part process. The NAD plus strip is sandwiched between two other critical treatments, starting off with a mandatory primer called a Myers cocktail IV. So what exactly is a Myers cocktail? Well, before that intense NAD hits your system, the doctor administers this specific bag packed with foundational vitamins and minerals. We're talking B complex, B12, magnesium, calcium, zinc, and taurine. According to the clinician, taurine is specifically great for your heart and brain function. And the patient even notes that, hey, on its own, this cocktail provides a nice replenishing boost of energy. But in the context of an NAD treatment, it serves a much, much more strategic purpose. You see, this specific vitamin cocktail isn't just for a quick energy boost. It's actually a completely necessary 15 to 20-minute hydration step designed to protect the body. The doctor explicitly states that priming with a Myers bag helps mitigate the severe sensations of the upcoming NAD plus strip, things like chest tightness, nausea, and heart palpitations. Think of it like putting armor on your cells before the floodgates completely open. Moving on to Section 2, the NAD plus drip process, the main event. Now that the patient is fully hydrated and primed, we move to the administration of a robust 500 milligram NAD plus dose. The moment the strip starts, the change is literal and instantaneous. The patient immediately describes a physical rush, kind of comparing it to that stomach-dropping feeling of going down a roller coaster. The doctor validates this right away, explaining that this dramatic sensation happens because your body, your cells, are actively taking up the NAD and processing it in real time. It's not some delayed reaction, it's immediate cellular uptake. Now, what's really fascinating here is that the patient feels an intense physical sensation directly in their chest and stomach. The doctor points out an incredible biological reason for this. We actually have a massive density of mitochondria, the powerhouses of our cells, located deep in our chest, our heart, and our gut. So when that NAD fluid hits, it is literally waking up every single cell in those specific areas, which instantly speeds up motility and causes that visceral, heavy sensation. Which brings us to Section 3, handling side effects, the intense sensations. Because let's be honest, waking up those cells isn't exactly a gentle process. While they might sound totally terrifying to the uninitiated, these rapid onset sensations are entirely expected. Acute chest tightness, feeling a sudden fullness or slight nausea in the stomach like you need to use the bathroom, elevated heart palpitations, and a sudden glistening sweat. These are just the classic hallmarks of a fast-dripping NAD IV. I mean, the patient literally remarks that his chest cavity feels like it might pop. Yet strangely, as the body processes it, there is this weird biological craving for that feeling of cellular awakening. But here is the absolute ultimate reassurance for anyone who might be a little intimidated by this whole process. Just the number one drip per second. Through a bit of trial and error during the hour-long session, the patient and doctor discover the exact sweet spot to completely control that intense rush. And that sweet spot is literally just one single drip per second. During an NAD IV, you, the patient, are always entirely in control. Speed dictates intensity.
If the patient feels too much chest pressure or starts sweating profusely, all they have to do is just ask the doctor to adjust that little IV speed dial. Actually, it's that simple. By just slowing the drip down, those uncomfortable side effects disappear instantly. Sure, it might take 2 hours instead of 1 to finish the bag, but the physical discomfort is 100% manageable and completely customizable to you.
Section 4. The different feeling, glutathione and the afterglow. As that intense NAD bag finally runs empty, the journey transitions into its final stage. To finish up the procedure, the doctor administers a massive 2,800 milligram push of cold glutathione via 2 syringes right straight into the IV line. Why glutathione? Well, the clinic notes that this incredibly powerful antioxidant specifically helps clear brain fog and aids in detoxifying the body. It even assists folks dealing with mold exposure toxicity. After this cold push, the patient just needs to sit back and wait about 20 minutes for that ultimate mental clarity to fully lock in. So how does this newfound energy actually feel compared to what we're used to? I mean, we all know the feeling of slamming a Monster energy drink or chugging coffee, right? It gives you a temporary heart-racing rush, but it's almost always accompanied by jitters, anxiety, and just this dirty, nervous energy. The NAD plus afterglow is profoundly different. The patient describes it as feeling incredibly clean, euphoric, and deeply grounded. It's this pure, calm energy that is completely devoid of anxiety. As the physical intensity of the drip totally fades away, the patient has this absolute revelation. It's an energy that feels like every cell in your body feels alive. There's this clarity in my mind. He goes on to say he feels strong, clean, and just completely cognitively optimized, even joking that he feels like he could suddenly solve complex math equations or sprint at top speed. It's truly a feeling of peak, optimal bodily function. Finally, Section 5, Doctor's Advice covering protocols and next steps. A cellular reset like that sounds absolutely incredible, right? But it does require a structured clinical approach. According to the clinic's protocol, your ideal scheduling really depends on your readiness. If you're a bit concerned about those intense side effects we talked about, the doctor recommends a mild starting dose of 250 milligrams. If you're ready for the full impact, you can jump right in at 500 milligrams. As for the frequency, they recommend once a month, carried out for an initial duration of 6 straight months to properly establish sustained vitality and allow for that deep, deep cellular repair. And this right here is exactly why doctors recommend NAD for way more than just a quick energy fix. As we age, our natural NAD production naturally declines, thanks to stress, poor nutrition, lack of sleep, you name it. Studies mentioned by the clinic show that consistent NAD replenishment can actively combat slow motivation and alleviate depression. Fascinatingly enough, because it chemically grounds the brain and massively reduces anxiety, they even use a 7-day intensive protocol at addiction clinics to assist with severe alcohol withdrawals. It's pretty amazing stuff. We've walked through the intense preparation, the absolute roller coaster of the actual drip, and that profoundly clear, euphoric afterglow. Knowing now that those intimidating sensations are perfectly manageable just by twisting a little dial, it leaves us with one final thought. If you've been feeling sluggish, anxious, or just totally disconnected from your body's true potential, you really have to ask yourself, are your cells ready to wake up? Thank you so much for joining me on this explainer. Keep exploring, keep learning, and I'll see you on our next deep dive.